The room smelled faintly of antiseptic and something else. Something metallic. She had been told the pain in her chest was just anxiety. The nurse glanced at the monitor once, jotted something down, and left. 2 hours later, she was unresponsive. The chart said stable. The truth said otherwise. You think you'd notice if you were in danger at the hospital, right? That's what she thought too. Before I take you inside this story, ask yourself, would you know how to spot medical negligence before it's too late? By the end of this video, you will. But I'll warn you, some of the signs are subtle, and they're often hiding in plain sight. And if you're new here, I share real and dramatized true crime stories inside the healthcare system. Stories they don't put in glossy brochures. If that's your thing, hit subscribe so you never miss our health, safety, and education series. It started in the waiting room. The woman, we'll call her Marina, sat clutching her ribs. Each breath made her wince. The triage nurse barely looked up. "We're full," she said, pushing a clipboard toward her. 45 minutes later, Marina's skin had a faint bluish tint around her lips. That's a danger sign, a possible lack of oxygen. But no one checked her vitals again. That's the first sign of negligence most people miss. 1. Staff stop reassessing your condition as it changes. In a functioning system, worsening symptoms trigger a faster response, not silence. If this happened to you or someone you loved, what would you do first? Would you wait quietly? Or speak up? Tell me in the comments. I'm curious how you'd react. Marina was finally wheeled into a room. 10 minutes later, a monitor beeped faintly. She watched the green line dance, trusting the hospital's rhythm. But here's the thing. No one was watching that monitor. A nurse came in, pressed a few buttons, then walked out without explaining a thing. That's the second sign. 2. Ignored or silenced alarms without action. Alarms are not background noise. They're designed to warn of immediate threats. And if you've ever been in a hospital and wondered, is anyone actually watching me? The answer might be scarier than you think. Later that night, Marina overheard 2 staff members arguing quietly. Something about no entry for her last medication. That's another sign. 3. Gaps or errors in your medical chart. Your chart is supposed to tell the truth of your care. If doses aren't recorded, times are wrong or entire visits vanish. It's more than sloppy, it can be dangerous. Have you ever looked at your hospital records? Drop a comment with yes if you have. I want to know. Sometime after midnight, Marina pressed the red call button. The light above her door blinked patiently. 5 minutes passed, 10, 15. She pressed it again. Nothing. That's the 4th sign. 4. Unanswered call lights or delayed responses to urgent needs. Hospitals are busy, but your cry for help shouldn't be background noise. Hospitals are busy, but your cry for help shouldn't be background noise. So here's a quick poll. If your call light isn't answered, do you A. Wait patiently, B. Press it again, or C. Call a friend to alert the nurse's station? Marina's blood test had been taken hours ago. No one told her the results. No one explained why her pain medication had been switched. That's the 5th sign. 5. Lack of communication about your diagnosis, treatment, or test results. You have the right to know what's happening inside your own body. And if you're still here, you've probably realized something. Negligence doesn't always look like a dramatic mistake. Sometimes it's a series of small silences, each one stealing time you don't have. By morning, Marina was weaker. A new doctor walked in, scanned her chart, and assumed everything overnight had gone smoothly. That's the 6th sign. 6. Staff making assumptions instead of verifying your condition. If they're not asking you questions, they're guessing. Here's a tip. If you sense assumptions are being made, interrupt politely. Actually, something changed last night. Let me tell you what happened. Quick pause. If these warning signs are hitting hard, subscribe now. I post stories every week that could literally save your life. And hit like so more people get this in their feed. Marina noticed that every time the shift changed, she had to re-explain her situation from scratch. That's the 7th sign. 7. Poor handover between shifts. If critical information is only coming from you, not from their notes, your care is in danger. A specialist had been ordered for Marina. She overheard his name. She never saw him. That's the 8th sign. 8. Delayed or skipped specialist consultations. The right expertise too late is often useless. In a rush, a nurse called her by another patient's name. That's the 9th sign. 9. Misidentification of patients. A wrong name can mean a wrong treatment. Her final plea was pain in her left arm. The nurse said it was probably muscle strain. Hours later, it was a heart attack. That's the 10th sign. 10. New symptoms dismissed without proper examination. Marina survived, barely. It took an off-duty doctor visiting another patient to notice her distress and act immediately. When she woke up days later, she realized she'd been minutes from becoming another complication in a file. Now you know the 10 signs. No reassessment as your condition changes. Ignored alarms. Gaps in documentation. Unanswered call lights. No communication about care. Staff making assumptions. Poor shift handovers. Skipped specialist consults. Patient misidentification. Dismissed new symptoms. Would you spot them if they were happening to you? Tell me in the comments. And don't forget, subscribe now to Whitecoatsecrets channel so you're here for the next story. It might just be the one that saves you or a loved one. Cheers.